All right, so some of the reasons of why to get an evaluation. A lot of parents will notice that their children are starting to fall behind academically. Behaviors might be increasing, and that might be impeding learning. And then so parents will start questioning whether their child might have a disability or not. So these are all things that should be brought to attention to the school. Again, under that child fine, we need to be able to identify children with disabilities. Also, in order to receive any supports in school that would fall under special ed services, you must have an evaluation prior to getting qualified for an IEP. And then we'll get into it with the outside evaluations, but you might have an outside evaluation such as autism or ADHD. It's a wide range of diagnosis, and parents present that then to the school to see if there's any help that they can receive for academic wise. Alex, if you have anything else about why you might be getting a evaluation.
Yeah, I think you summed it up nicely. I think when there is calls to say that your child is having difficulties making educational gains, and we use the term educational purposely. It's not just about your academic skills, but it's also about your social emotional well-being too, behavioral needs and things of that nature. If they're having difficulties despite interventions and things in place, that would require a need for an evaluation to determine what other supports that are unique to this child are required so that they can get their education. That's what it's all about. Oops, did I go too far? There we go. Yeah,
Right.
it kind of segues into this slide.
Yeah, and we kind of touched base on different things of why you would need to have an evaluation. The main thing to get an evaluation would be to see if the child would need supports while they're in school. Otherwise, if they don't have that evaluation process to see what the needs are for the child, you're not going to have moving into an IEP or a possible 504. But that's really the core of the evaluation, to see where the strengths and needs of the child lie. Again, it's just if they have certain difficulties with any areas, reading, math, writing, any of those, again, to get support, whether that's through learning support or for behaviors, maybe the child needs autism support. Again, that evaluation is going to have to be performed and completed prior to getting those services. You're on mute. There you go.
Yeah, we're going to touch base on it later, but yeah, so this evaluation is in the school's template, the school, individual schools format of it. So that's what these initial evaluations or reevaluations look like, where they might consider some of the outside input or even outside evaluations, but they have to be on school templates. And this, hence it's the school's responsibility to collect it and get that information to determine the nature of the child's needs and make sure that they are then recommending the appropriate services as well. Yeah, the list of like academic areas is rather expansive. I mean, it goes all the way from your basic reading skills to math skills to written language skills to that of even things related to listening and speaking. And I mentioned about the behavioral things already, and the behavioral things can look like in a variety of different ways, whether it be things related to mental health, things consistent with autism, but also physical impairments as well, such as deaf or hard of hearing, or multiple disabilities that a student may have, where if you see them and you recognize the nature of the need, you see like they were going to have a difficult time being instructed in the just with general education supports, which they're not as expansive as special education supports, and they'll need some additional things so that they can be appropriately educated. And the job of an evaluation is to find out what are those strategies, what are those things so that appropriate education can occur, and hopes that we can give the student the best access to general education to the highest degree possible.
All right, so now this is kind of getting more into the nitty gritty of the actual evaluation. So how to go about getting an evaluation. Um, the most common way is that parents just request an evaluation. Now, this needs to be put in writing and given to the school. Um, Typically an email or a letter. There's some formats that are provided under, like Patan has a format. There's different ones online, but I always usually just tell families, a brief little summary of you would like to request an evaluation for special ed services, and then maybe give a reason why. And then with this, it'll go into the next process of setting up a meeting. Typically that is within a 10-day time span. We'll get into time frames here soon. Or the other way, a school could make a request to evaluate. So the school could be noticing that a child's behaviors are starting to escalate and it's impeding the learning of his or others. So the school might approach the family to see if they're noticing anything and if they're possibly wondering if he might have a disability and if they want to further look into that. One of the other main reasons to get an evaluation is the timeline for the initial evaluation is up. So again, we'll get into timelines, but if a reevaluation is ready to be performed, that will move into a new evaluation process. But the main important thing out of any of these is that parental consent has to be given in order for evaluations to start. So if the school requests an evaluation and the parents do not sign off on it, the evaluation cannot start without that signature. So that's one of the main points, is that the parents need to know what the evaluation is going to look like, what assessments are on there, and they need to be able to comprehend everything that's being relayed back to them about the evaluation.
Yeah, that's right, Lakin. We have an obligation, I mean, as a school district, to be very clear so if the school is the one recommending the evaluation, of why we're recommending the evaluation and what we're going to do, what information are we going to collect. It's our way of being transparent, so that there's no questions about what exactly we're investigating and how we're going to do it. With that, though, we also have an obligation to have a comprehensive evaluation. And so you also have to look at other types of factors that could be influencing a kiddo in the school environment. So if it's just academic needs, we're still obligated to make some type of comment of how they're doing socially and emotionally. That may not look like we're doing like a full blown out assessment to look into, things related to mental health. But what we will do is we'll ask teachers, we'll ask even the parent or guardian, hey, how are they doing at home? How are they making friends? How are they interacting with adults? So you kind of get that type of information so that it's comprehensive in that way. Sometimes I get parents or guardians that are just kind of uncomfortable with some of the instruments that we propose to use, but that's where dialogue needs to come into play. So let's just open up the conversation and express, well, why are you comfortable? Why are you uncomfortable with these assessments? And we can come with some type of agreement, a common ground, so that we can move forward. Because I think at the end of the day, what schools want and what parents and guardians want is the services in place. Now, those services could vary. What is needed so that this student can improve, can be successful during the school day.
So before we move on to the next slide, I have down here, just to kind of reiterate parental consent, because it is a big one. There's 3 breakdowns of that. So you have been fully informed in your native language or another mode of communication of all information that the action in which consent is sought. So if you need a translator, that can be given, that's presented by the school. A lot of times they have ones that can call in, they have translators that are provided by the school. The second part, you understand and agree in writing to the action and the consent, describes that action and lists the records that will be released and to whom. So if there's any outside reports at this point, that's when they would be provided. And the school would be have to have a release signed by the parents if they want any outside information to be released, and they're the ones that are collecting that information. And then the third part is you understand that the consent does not negate an action that has occurred after you gave your consent and before you withdrew it. So if you go ahead and consent and then they go ahead with the action and you withdraw it, you cannot go back on the initial action that was taking place due to the parental consent.
If all that seemed a lot of wordy, that's definitely like litigation type of talk there. So it's important for even schools and parents to kind of break down, hey, what does this actually mean? What does this look like in practice? So Lakin, thank you for explaining that.
Yep. Okay, so and we'll get a little bit more detailed into the timelines of stuff, but this is just an overview just for the reevaluation process. So the initial evaluation is a little different. The reevaluation is after a child has already been evaluated and found eligible for an IEP. So if they're already receiving services, and then they'll move into a reevaluation once the time frame's up. So this would be every 3 years, and then if your child has IDD, it would be every 2 years. Now, parents can waive this reevaluation process, except for ID kiddos. Those reevaluations have to occur. And I'll let Alex go into a little bit more detail of what that could actually look like with it being waived, or if it's like a review of records.
Right. So when reevaluations come up for students that already are receiving special education, they can look like a couple forms that Lakin indicated. So one, the most typical, most common thing that happens with reevaluations is not reevaluations with updated assessments from outside providers from their typical school day, or updated assessments from somebody like a school psychologist. But what is reported on those reevaluations without updated assessments is loosely, it's kind of misleading, because there are assessments. Students are assessed all the time during the school day. So it's the assessments that are reported in their everyday schooling, everyday program. And oftentimes that's even more rich than the assessments that typically I would provide, because what those assessments really get down to is, what are the students' instructional level? Are they making gains? Are they making gains relative to their IEP goals? Are they making gains relative to their grade level types of goals? And so oftentimes with that rich information, if it's a nice review of records that occur just on a regular standard basis, we're going to have enough information there to say that, hey, we know that this student is still in need. They are making gains. We might need to tweak the program a little bit, but overall, this seems to be a pretty good match of what we're seeing here in the paperwork and the student's program. And so we don't necessarily require additional information than what we already have. We know that the student's still looking like, they have, let's say, a learning disability, and we know that this program is working for them. So at that point in time, we can say the student is still eligible for services. We don't require updated assessments, and then we can move on to the IEP piece of it all. Another format, another way of how the reevaluation might unfold is if there are questions about the programming. We notice that the student is not making gains. The review of records that we have conducted shows that there's little growth. We've changed some goals. IEP meetings have occurred to change some delivery of services, but we still seem to be off the mark because there's no gains being made. That may require then a reevaluation with updated assessments. Now, once the team decides that there's updated assessments, that then requires parental consent at that point, because now we're doing additional things that we would do beyond that of the regular school day. And that's where typically the school psychologist would then get involved with the case once again to find out, hey, do we need to reconsider how the student presents? Are we off the mark with The type of identification that we have are there more emotional concerns that we need to consider? Do we need more comprehensive programming for the student? And those updated assessments that are more diagnostic based can help us drive what to do next. And again, the goal of all of this is to, one, make sure that we have the right identification, and then two, we're collecting information so that we have informed decisions about the most appropriate programming. And then lastly, that third option would be the waiver. Now, transparently, we have the message in our school district, which is the South Middleton School District, that that's not best practice is to do waivers. So oftentimes when we do waivers, it's the result of an extreme absence because the students may have been hospitalized for a long period of time that we just couldn't collect information. If parents want to waive the reevaluation, we grant them that, but we try to explain why that may be a good thing or a bad thing, but we'll honor that request. But there's, just certain circumstances that we may waive it, but its general practice is that at the very least, we're doing a reevaluation with the record review to determine that it is an appropriate programming. And if not, then we would then request updated assessments from there, if that kind of logic makes sense.
And parents would have to sign off on that waiver. So school districts will not just go behind parents' backs and waive it on their own. They have to have a form signed, or the state that could be a big complaint against the state. So.
Yeah, absolutely. And it's just not good practice. Like, I think we're committed to do things that we feel is appropriate to students. It's the student first. And if we're just doing things to be compliant, then we may not be in it for the right reason. So we want partnerships. We want to try to do our best. So I'm hoping that with your workings with the school districts and psychologists that you're experiencing the same thing. Timelines.
All right, so timelines, and these go for either evaluations or reevaluations. So it's the same across the board. There'll be a request for an evaluation, and then now typically the parent's going to do the initial request like we talked about before. The school can make that request, but typically that is the parents. A reasonable amount of time is how it's stated legally. That's typically 10 calendar days. The schools usually do fit within that 10 days unless scheduling is a conflict between the families and the staff getting together for a meeting. So how it's stated in the regs is a reasonable amount of time. Then also it's the same with the RR, the reasonable amount of time. Typically that's going to go with the 10-day time frame again. So then after that request is made, the team typically will have a meeting and they'll sit down and address the concerns of why they feel this child should be evaluated. Now, with the reevaluation, they're already aware that the child has an IEP and the reevaluation just needs to be done. So it might not move necessarily into a meeting unless they want to move further into doing more assessments of that child versus that typical day of what that might look like. Then they're going to offer this, it's called a permission to evaluate, and schools will use acronyms all the time. And that's
alphabet soup, really.
Yes, it's a lot of letters, but they'll call it a PTE, and that's just permission to evaluate. And this is just signing that the parent is agreeing to have the child evaluated. The school cannot move ahead until that form is signed off on. And then once that form is signed, they have 60 calendar days for school to get that evaluation completed. Over summer break, it freezes. They can't do assessments over the summer, so that will not count as part of the 60 days. So a lot of times what we'll do, if it's in the last week or two of school and they want to evaluate a child, they'll wait to sign the PTE until the beginning of the school year, so it just starts the clock fresh. But that's always just kind of be a note. You might stop the evaluation in the middle, so that's always something just to be mindful of. If you're starting an evaluation in 5th grade, you might be starting it in 6th grade, and that might look very differently academically. Parents then will receive a copy of the evaluation at least 10 days prior to the IEP meeting, unless they waive that it's okay to receive it after that 10-day mark. And then if found eligible, the team must have an IEP meeting within 30 calendar days from the time that the RR was signed off on. Sometimes families will waive that 30 days and they'll actually move right into the IEP meeting following that evaluation. So a lot of times it's just easier to get a big team meeting in one day and just knock out the evaluation and the IEP together. But schools are allowed to have that 30-day window after the RR or the ER, which is the initial evaluation. So that's just another time frame that's kind of in there.
Yeah, that time frame's in there to help coordinate the appropriate services. So what we're proposing with the IP to make sure that they're on place and hoping that we can start those immediately after that IEP meeting. In my experience, oftentimes that it doesn't take the entire 30 days, but it just kind of gives that wiggle room just in case. I want to revisit the meeting that often occurs after a request is made. And the reason why it's good practice to meet. It's trust me, it's not because we're trying to delay anything, but the reason is we want to make sure that we truly know the nature of concerns as well as strengths for the student. And there's a key reason as to why, because if they're academic things that are first being brought up, but then teachers are noticing, hey, I recognize there might be, I noticed this student has a difficult time understanding directions. And then the parents say, oh yeah, I see that too. Well, then maybe that would require a speech and language assessment as well. And oftentimes, if we don't have that meeting and then the psychologist is working and trying to kind of unpack some of the nature of these needs, they find reason to say like, hey, wait a minute, I think we need the speech language clinician to look into this. Then all of a sudden we're scrambling to resend an evaluation consent so that parents are informed about this next step. So if we can kind of do all of this at once, so we have more of a comprehensive plan of what this evaluation is going to look like, we're not scrambling during that time, during the evaluation window itself. So it's good practice to kind of everybody's to get together as a team to make sure that we are looking into every single aspect that we need to look into.
On our end as advocates, we do push that a meeting does happen just so that we can explore, again, those strengths and weaknesses of the child across the whole team. There are some times that the team do want to move forward with the PTE without having a meeting. And then typically what I recommend to parents, if that's the route that they want to go just to move it on a little quicker, is that they send us the PTE so that we can review what's actually on the PTE. Because sometimes, for whatever reason, if they have a kiddo with maybe articulation problems, that they only want to evaluate speech services. And, you know, looking over the academics, we might see that there's a deficit in math. So then that's when I would pull a meeting together and be like, no, I think this needs to be looked into a little bit more. So that's where that back and forth is with our families, is just kind of making sure everyone gets the whole picture of everything.
The whole picture is a good term. And if we can get together, have that picture just become clear at the very start, it makes the process go a little bit smoother in my experience. Are you ready to roll to the next slide, Lakin?
Yep.
Okay. Here we go. What type of assessments?
This is kind of an umbrella question. So what types of evals and assessments are there? It all depends on the individual of what you're actually going to test them on. And I'll let Alex talk a little bit more to that in a minute. But in general, I have listed on here just a couple different evaluation terms that you may hear. And some of them are big words, and a lot of times we realize that parents aren't always aware of what these terms actually mean. So we're going to break them down a little bit just so that you're aware of what should be tested for each of these sections. But again, I'll let Alex touch on exactly the route that schools take on what assessments should be done per kid.
Yeah, yeah, and just kind of revisiting what I said before. So this is, you can see the types of evals that take place. So as the nature of those concerns are unfolded during that first meeting, it kind of gives the school direction. Oh, there are concerns about body movement and accessing the environment. So we might need like a physical therapist to come in and be a part of this evaluation, in addition to looking at academic skills. It's really about how students are accessing their environment and their education. So think about physical, mental, and behavioral. And evaluations kind of cover all those things. So physical, hearing, motor movement, fine motor movement with writing. That's where the occupational therapy comes into play. And fine motor movement, even with the adaptive skills that you see with some children, rather just be like dressing. Again, that's all part of learning. I think by the end of schooling, we would hope that we're addressing those adaptive needs too, and these assessments come into play for that. So I'm not going to go over each one of these, but we're going to cover some of the more common ones, that the type of assessments that are provided within schools.
So a lot of times you'll hear that schools want to do an MDE, which is a multidisciplinary evaluation, or you'll just hear a school eval. So the psychological school eval kind of goes hand in hand. You might hear them. It just depends on the school. But again, those letters MDE, or you'll just hear a school psych eval. And then this is kind of your likelihood here, so I'll let you.
Yeah, I'll take it. I can take it here. So, what's involved with this evaluation as far as what happens in the one-on-one testing setting with the student? Oftentimes, there is a cognitive assessment to that. And by cognitive, I just like to frame it of how students learn. It's not what they learned yet. So how they learn is, how do they think? How do they use their verbal knowledge? Are they able to detect things in picture format? Their nonverbal knowledge? How's their memory? And that'll start to get us thinking and hypothesizing, are they within a developmentally appropriate level within these types of measures, or are there weaknesses that are starting to emerge? And if so, how are those weaknesses impacting their academic skills? Which leads to the next piece, the achievement testing. So achievement isn't just like achievement testing of how well are they setting, like getting to these milestones, like, you know, they pass the grade, that's achievement. So achievement in this definition is just their academic skills. Are they achieving skills in reading, writing, math, listening comprehension, and oral expression? School psychologists even look at things related to that, in addition to speech and language therapist. So the achievement testing will help determine if there are academic needs and structural needs for that student. And if so, how far away are they from grade level to determine, can these needs be overcome within the current grade setting, or with supports available so that they can still receive instruction on their grade level? Or right now, is it so far below grade level that they need a different instructional set to hopefully get them to grade level someday? So for instance, a student that may be in 4th grade is still developing their basic reading skills of their phonological skills, putting sounds to letters, and those letters blend and make sounds so you can able to read accurately. If there's needs in the fourth grade for that, chances are that's below grade level. Now, to what extent, how often do they occur? That's where the achievement testings then coming into play. And we are trying to determine now, was there adequate instruction for this child over the course of time? Were there qualified teachers? Was there ever a big break in their education? And if we can say like none of these factors in place, so despite having this quality instruction put in place, this student is still not necessarily achieving, then we can start to think about the presence of a learning disability. And then what recommendations then do we have instructionally based upon how they did on this achievement testing? The adaptive behavior piece often occurs with students that are struggling with their daily living skills. So that would be like communicating to their teacher, what their ability to navigate the school setting. Can they go from place to place without getting injured, without getting lost? Are they able to go outside and go from one place to another following rules of safety? Are they able to use the restroom in a safe manner? So that's the adaptive behavior. Think of that as what skills do we do every day that makes us independent? And all of these measures are comparing that student to not adults, so like we have to be fair to who we're comparing them to. The scores are compared to typically other peers their age. So these tests have been normed reference, which means they compare what's average to other peers in a variety of age groups. So depending upon the student's age, we look to see if these behaviors or these academic achievement skills or these intellectual abilities are common with other kiddos their age. And when they are common, okay, that shows us they're within a developmentally appropriate level. It doesn't seem to be consistent with a disability. There might be some other factors going on that's not disability related, but we could recommend other things as a school, maybe not special education, to help this kiddo out. Or it could be showing that this student has substantial difficulties in some of these areas that are really starting to show that, yeah, in all likelihood, there is a type of learning disability or an educational need for additional supports. The behavioral rating scales are in the functional behavior assessments, and the functional behavior assessments often use behavioral rating scales. So behavioral rating scales look at all kinds of things about how a student acts in school. And there's a lot out there. I mean, this is there's a lot of publishers out there. We try to select ones that are going to be most appropriate for our school. And so one of the more common ones that we have looks at all kinds of different dimensions, factors of behavior: anxiety, depression, so the internalizing piece of it all. And then that same rating scale looks at the external piece of it all, like, are they getting up out of their seat? Are they calling out? Are they having physical fights? Are they argumentative? So that's some of the external sides of behavior that we see. And then also social skills. And so that's kind of like a broad umbrella rating scale that we use to kind of look at a little bit of everything. Now, if there's a specific assessment, if we're looking into things such as autism, we have rating scales that directly look into autism. In fact, they're called the autistic rating scales for children. I mean, it's pretty clear of what they're going to be used for. And those particular scales look at their students' ability to understand what others are saying, perspective taking, things of that. So they're kind of get more narrow as you go. But we'll use those rating scales as well to get a sense of how well is this student doing as per the teacher perspective, the parent perspective, and the student perspective compared to what other peers their age are doing. And then the attention rating scales are, kind of fall under that narrow range of the behavior rating scales as well. And of course, we do observations. We'll go into classrooms, and I think school psychologists, more than any other like outpatient psychologist, we actually can see the students live learning. And so we can get a sense of, are they paying attention? If they're not paying attention, are other kids not paying attention? Because sometimes, believe it or not, some teachers struggle with classroom management, and it's not because the student themselves may not have an attention problem, but the classroom setting just could be not very structured enough that really promotes learning. So we kind of get a sense of, yeah, the student's not paying attention, but neither is 90% of the other kiddos in this classroom right now, which could be a reason why learning isn't happening. We also get a chance to see students in unstructured settings, unlike outpatient psychologists too. So we actually get a chance to go see students play in the recess yard. So if there's social skill concerns going on, we get a chance to see if they are engaging, are they interacting with peers? If so, what does that look like? Are they following the plan of the group? So we can really get some really rich information from these observations that not only help us diagnostically, but they also help inform recommendations too of what we can do to help get this kiddo on the right path. I don't know if you can tell by my voice, but I get passionate about this stuff. All right. Anything else you need to address here, Lakin?
I think the only thing is with the cognitive testing, typically parents will think IQ testing because that's what they're going to be looking at is their full scale IQ eventually based off that test, the subsets and everything. So if you hear IQ test, that's going to correlate to cognitive testing.
That's correct. Yep. Thank you, Lakin. All right.
All right, so speech and language, the biggest thing with this is there's two very different key components to this, and a lot of people when they think the child needs to be assessed for speech, they think articulation, and that is a big part of it, but if the child can articulate, they can still be evaluated for speech services for the language part. So pragmatic language is what they're going to be looking at, receptive language and expressive language. So how do you say it? Are they able to understand what you're saying? Are they understanding body language? Are they doing the appropriate body language when they're talking? It's that back and forthness, just in a social context. So, and Alex, you can talk more on that, but those are the two key components to speech and language.
Yeah, I think you nailed it. Now I can't represent, I'm not a speech language clinician, but that's exactly what they're looking for. And you can see how if one's having a hard time with listening and understanding because of different brain connections that speech clinicians are certified to look into, you can see how when teachers are talking out loud, not using, there might be some other strategy they can use such as visuals, but if it's only by one way of hearing, they may not understand what's going on, and it could be due to a speech language impairment that's beyond that of just not saying different sounds correctly.
And this will be different if the student does speak a different language and English is not their first language. They might not qualify for speech and language. It might just be an English second language is what they need. So you'll hear the term OT, another acronym, but it stands for occupational therapy. A lot of times they will be looking at fine motor, the visual motor, handwriting, and again, Alex, you can go a little bit more in depth on actually what they're looking at, but sensory processing is another big one that OT assesses, and that's typically going to be for your kiddos that are on the spectrum. Not necessarily just those kiddos, but it's going to be where the bigger one is when they need that sensory diet added into their school day.
Sure, yeah. I think some of the other things are kind of self-explanatory about their fine motor skills. They're going to help with handwriting quality if it's not legible. And they are, remember, it's got to be the most intense needs. I think, all of us at one point in time may have had some poor handwriting. It's all about legibility and again, compared to other peers their age. And so that's how they'll start identifying whether or not they need these unique services, is because you also are always comparing their skills to others their age. But it goes beyond that of just writing and the fine motor components that I talked about. But sensory, I think when we talk sensory, again, that's an umbrella term. If you think of just what senses are, it's how we perceive things through multiple different ways, whether that would be hearing, seeing, smelling, tasting, touching. And they look into students' needs if they are constantly touching particular types of textures that may be distracting to them. Are students purposely going out to try to seek out those textures? Well, what can we do so students are at least staying within their expected area and available to learn? So there could be like some tactile things that we can put close to their desk. If students have that hyperactivity, that they need to move a lot, need to stand. We use our occupational therapist a lot to assess some of the environmental needs. Can we put bands between the legs of their desk so they have something to kind of go back and forth on, and helps with their movement? Some students, they actually need to move to learn. And so there's a lot of tools to put in place that occupational therapists are very knowledgeable of what tools we can put in the classroom. So students are moving, they're not being superly distracted or others being distracted by them. Even in the form of, sometimes there are, if you notice students that are constantly chewing on pencils, there's actually writing utensils out there that are made to be chewed too. So we just want to make sure students are safe. Oftentimes, if we try to stop that behavior, it leads to more frustration to the student. And so one of the first things we like to do is replace that item that the student might be chewing with something that at least is healthy. And then we can go down the road of working with stopping that behavior altogether. And OT's really helpful in those cases.
All right, and this is kind of just some other assessments that can be completed. Not every child needs these assessments. Again, the assessment, there has to be a need for that assessment. So the child has to be showing something that needs to be further looked into. So physical therapy might be a kiddo that can't walk up and down stairs very well, and they're in the middle school and he has to walk up a flight of stairs to get the second period. So they might do an assessment for PT to work on getting him to walk upstairs appropriately. The assistive tech, that's going to be your kiddos that have the iPad or any kind of devices that would help them communicate better with their peers, the staff, their parents. Again, not every student's going to qualify for that, but if they're able to go ahead and use that technology, then we can look into doing that assessment.
And like in my experience with the assistive technology, oftentimes our occupational therapists play big roles in that type of assessment as well.
And then, yeah, typically with that assistive tech, you're going to be looking at the like fine motor. First of all, can they navigate the device? And then speech will actually be the ones that typically follow through with teaching them how to communicate with that. Transition, every kid at the age of 14 will start looking at transition for adulthood. And that comes a little bit later in the IEP of like how that actually is worked out with goals and everything. But that transition, you're not going to assess a second grader on what they want to do when they get out of high school. And then we put ASD under here because for autism testing, it is a big one in schools with the rate of autism increasing every year, it seems. So that is a big assessment that can be done, but it's only given if it's a suspected autism kiddo. So if your kiddo might just be having a deficit in math, the psychologist isn't going to move forward with an ASD testing if there's no need for it.
No, and autism, you're going to find that different schools do different things with that. It really depends upon the expertise of the psychologist. If they feel that they have the knowledge and the skill and the tools available to perform assessments to identify autism, then schools can do that. But oftentimes you see that psychologists may not feel comfortable with that. They don't have the necessary education, experience, and mentorship for such assessments. So school districts may actually use another provider and pay for that provider to do such an assessment. Sometimes that looks like a psychiatric evaluation. Sometimes it looks like other specialists coming in to do that. But the school district would be the ones selecting that provider and also financially covering it as well. So, psychiatric.
No, go ahead. I'll let you
right,
handle
I know,
this
right?
one. This one's your
it's
area.
like we tried this, right? So it's psychiatric evaluations involve an appointment with a psychiatrist that typically has a partnership with that school. And that partnership needs to be board approved. Typically, there's a memorandum of understanding so that this is the psychiatrist that we see, but it's only for evaluative purposes. The psychiatrist will not then provide treatment following it, but it's to have more of a clear diagnostic impression for some of those cases that really it goes beyond that of expertise of school psychologists. I mean, we can't know everything in the mental health field, giving what our practice is, where mental health and school meet. So some of those nuances about, is this autism or is this some other type of expression of a mental health disorder? It's not quite autism. We're not sure. However, we would like to pursue a psychiatric evaluation to cover this. Oftentimes the schools, in my experience, the schools are the ones recommending this. This isn't standard practice. This is kind of going above and beyond that of most educational evaluations, but it's really to ensure that we are, one, identifying correctly and also informed of the most appropriate treatment for the child. Oftentimes, it's really for the most severe behavioral cases that we see. Neuropsychological assessments, again, depends upon the expertise of your school psychologist. In the past, there might be some neuropsychological clinics that were provided by the intermediate units that look into more of the intellectual presentation of the child. So when we say neuro, it's more of the specific areas and testing areas that and instruments that we have available to pinpoint areas of strength or need. So for instance, some areas may include not just your overall memory, but your ability to remember things that you heard and then remembering things that you saw. So it kind of really starts to tease out some areas that are strengths and weaknesses, which again, the overall goal is to let's form instruction behind this. If we know that students are auditory learners, we can use this neuropsychological assessment to find that out. In my experience, I mean, I've had training through my internship and then through the course of my time at South Middleton in neuropsychological assessment battery. In fact, I worked for an outside provider in the Hanover area under his supervision doing neuropsychological assessments. So we feel very competent in this area and we have measures with it. So oftentimes that you will find that school psychologists actually do neuropsychological assessments.
All right, so independent educational evaluations, another acronym, IEE, but in typical language, you're going to hear outside evaluation is what they're going to be called. The schools will call them independent. So first and foremost with this, if a kiddo has an outside evaluation and they were founded that they have some kind of diagnosis, and the parents bring that into the school, that does not mean that they are going to qualify for an IEP. You have to go through the school evaluation process that there's a very big difference between a medical diagnosis and an educational diagnosis. Now, if a child says they go out to an outside evaluation and they get the diagnosis of autism, and the school presents, or the parent presents to the school, my child now has this autism diagnosis, I need an IEP. So they go through the evaluation process, and in a school setting, his autism does not affect him behaviorally, socially, or academically. There's no issues at school, but at home he might have a social piece that's throwing him off. And it does not mean that he doesn't have autism, he just has a medical diagnosis of autism. So it doesn't void one another out, it's just two different labels and how that's presented with supports.
Lakey, that's a really good example. And in cases like that where academically they're doing well in small groups, when they're working in small groups, that student still is doing well, they're contributing. So the social effects of autism may not be seen to that, to the same intensity outside of school. And because of that, there's no need. Remember, these evaluations are two-pronged process. Not only does there need to be a disability established, but then the need for it too. So if the student's not showing the need, they're not showing the need for special education, which to me isn't a bad thing. It's actually a testament of resilience. So, despite this type of limitation, they're still maintaining age-appropriate growth in a lot of other areas, which I think is fantastic. And also when it comes to our independent evaluations that we receive, we do consider them. And there's some portion that do a very good job of getting that condition of making sure that they're comprehensive and they're using up-to-date assessments and they're getting information. The best ones actually get information from our teachers from a release from parents, and they're phenomenal. And usually those are no-brainer. We accept them almost immediately. But, and unfortunately, this is actually more common than not, is that we typically get outside evaluations that use outdated assessments that are no longer valid. For the last 3 years, we've been getting a achievement test from one particular provider that's about 20 years old, and it's been 2 editions since that point, and they're not valid or reliable measures, and that's one thing that we always have to rely on. And another thing is sometimes we just get scripts from medical doctors saying that this student needs an IEP, where that script holds no authority in the school system. So what holds the authority is that's a whole evaluation process. We can consider that doctor's recognitions like, hey, where's this coming from, and hold a meeting to explain the nature of where this is coming from. But just because somebody else on the outside says you got to do it, the school doesn't have to. The school has to go through this process to determine eligibility.
And then also with that, if the school does a evaluation and the parents are not in agreement with the findings of the school, the parents can ask for an independent evaluation. So with that, so the school would have to pay for that independent evaluation at that point. But first, the parents must disagree with the evaluation, and the school has to agree to the outside evaluation. And then you can go a little bit more in depth with that.
Yeah, that's how that process works. If there is a disagreement and the evaluation itself holds to that standard of it's multidisciplinary, uses multiple measures, it uses valid and reliable measures, and there's as an interpretation, there was a case that set precedent that the school doesn't have to say to parents that they have to grant this outside evaluation just because that you disagree. If it is a legally defensible evaluation, then that's where that stands. Now, that doesn't mean that it can't be evaluated again by the school. You can always request at another time and date. Oftentimes, schools have a certain timeline for that, and that's on a case-by-case basis. However, in these cases, it's not about the final ending point. I like to meet with parents, and if they are in a disagreement or just unsure or unclear, or there's a discrepancy what they see at home and what they see at school, I just like to have a conversation with them and explain what these results actually say, how they compare to what the student is doing in the classroom. And if there is like a legitimate reason as to why maybe this testing is invalid, like we'll say, okay, let's do an independent evaluation to do it. Oftentimes schools are agreeable to it if you bring it up. But again, I think just to make sure everybody's on the same page as to why you're requesting it, and build your case for that, not just because you disagree. I think that's a fair approach. All right, I'll try to go through this quickly, but in the evaluation itself, you're going to see a lot of numbers and things called standard scores or scaled scores. And as I mentioned, all of the tests that we administer specifically for that student is comparing that student's performance to other peers their age or peers in the same grade. And it's reported, and it looks like it's reported, it's compared to their performance on the normal curve here. So this is what this is. This is the normal curve. And each of these numbers goes to a different part of this normal curve. And as you see here in this column, if there's a number that's below here, like within this point here, it's a low performance. But the higher this curve goes, that actually means the more common that score is. So the more common the score is, the more age appropriate that it is. So I think that's kind of like one good rule of thumb when looking at this. When looking at the normal curve, the higher it goes, the more common the score, and more developmental it is. But as you get to the other end of the normal curve, it's no longer becoming common anymore. It's a less common score. However, it's on the higher end of the performance. So you can kind of get that, significant strengths you could see as well within students. So it's really just 3 phases. Is it within a low range, of age appropriate range, or advanced range? And then it kind of gets narrowed in between. Now the next slide that I have here, you're going to see these different types of scores. Actually, the next slide after this, I'm just going to go to the next one because all of these scores are going to be on the next slide. All of these scores are measuring the same thing. It's informing the child's performance compared to other peers their age based on this normal curve. So again, here's our normal curve. As you see, it comes up and down just like a hill. And all kinds of scores get reported in our measures. One of the most common ones is this one. It says sample standard score, or what we call standard score. So when Lakin mentioned about the IQ, IQs are reported in standard scores, where an average IQ is 100. As you see, 100 here, if you line that up with the normal curve, it gets to the highest point of the normal curve. And remember, the higher it goes, the more common it is. And it's average, it's dead average because that's the most common score. So 100 is the most common score. And when we say average, it doesn't mean like C average, it's okay. Average means it's developmentally appropriate. Now, the further away you go from this center, the less common those scores become. But we do have what we call the average range here. So if we're looking at standard scores, that average range goes from 85 to 115. Okay, so anything within that range, because we all have different things that we do well, not do well, all relative, that we all will likely fall within some point of this center of the normal curve, but it's still within an age appropriate range. Now, if we're talking about limitations or weaknesses, the further away you get from here, the lower the score, again, and the less common that score is. So when we're talking about things like learning disabilities, there are scores such, let's say there's their performance in reading comprehension. They end up getting a standard score of a 75, okay? A 75 would place them right around here on the normal curve. As you can see, that's not a common score, and it's not really that close to that average score. So it lends itself like this is a severe difficulty here. This is something that is a weakness that's not common to other peers their age, and it's worth more information. Did this student receive instruction? Is there other reasons why they're not comprehending what they're reading, and so forth? And then if we can say that they had all this instruction, we can say with more confidence that this is a disability. And just as there are disabilities, there are strengths too. So students could also score above this average range in the normal curve, where the scores would go in the standard score range all the way up and beyond of like 145. If you ever hear somebody say like, oh, I heard they have an IQ of 180, trust me, they're not using reliable tests, because there's not a single IQ test that we have that goes above a 160. So if they're getting 180s, I don't know what test they're using out there. But 145 is a really strong score, but usually 130 is that very advanced score when it comes to like things like IQ or just any type of academic skills. when you look at rating scales, remember the rating scales I was talking about, whether it be the ADHD rating scales, oftentimes they're reported in T-scores down below here. And I think they're just trying to confuse us all. But here the average is 50. But don't worry, inside the report itself, they should have descriptors as to what that score means. So whether that would be within the average range, above average range, below average range, just to kind of help you get a sense of, are we on par, are we not on par? But that's where those scores are coming from. I just wanted to try to debunk, demyth that type of thing, but it does get complicated. It's rest upon statistics and probabilities. Okay, enough of that psychobabble.
All right, how do results affect programming? So first and foremost, whatever the diagnosis is, that label does not determine your program. So with that being said, these results are going to show you where the child's strengths and deficits are, and then if they're found eligible that they need an IEP, that's when the team's going to move into what program is going to best suit this child's needs. So for example, the child is found to have an outside diagnosis of autism, but their receptive speech is not well. They don't understand what people are trying to say to them. Socially, they're just not aware. So when moving forward, they determine that autism is not an educational diagnosis, but maybe they need to have support in speech and language. So the label might be that they're just speech and language kiddos and not autism. So it's just a matter of really collecting all that data and looking at what the need of the child is and what that breaks down and what program's best going to help that child.
You're in really good hands with Lakin, because this is something that we even try to get across to some of our building level administrators sometimes, and teachers and so forth, that disability category does not necessarily need, or does not inform the need. What informs the needs is their needs, regardless of what their category is. And I think if there's anything to take away from this too, that's one thing. And I think with your next presentation, like with your, was it the ABCs of IEPs or something like that?
Yep.
Yeah, I think that will be a very much needed conversation as it flows into the actual IEP itself and programming, because it needs to be comprehensive. It's just not based upon one label.
All right, and then there's 3 outcomes at the end of any evaluation. The team as a whole will pick which one. So the first one is a student does not have a disability and therefore is not eligible for special ed. Typically at this point, they are done. The child's not getting any additional services. Now, some schools might have like a reading intervention that could be added in if it was like a learning disability of that sort. But it just depends on what the school has to offer. So then the second outcome is a student has a disability but does not need specially designed instruction. So they're not eligible for an IEP. With that being said, like going back to my previous example, so if a child had autism from an outside evaluation, but they did not qualify for the educational evaluation, this would be an appropriate outcome for that child. And it might move into the child needs a 504 plan. So, you know, maybe the child just needs a couple accommodations, preferred seating, extended time, something like that, but they don't actually need that direct instruction from a special ed teacher. So that's the big key component for eligibility, is that they have a disability and they need that one-on-one instruction of some sort. So, and then that goes right into the second outcome, and that's where they find that the child has both those needs and then therefore are eligible for special ed services. And then these are all the categories that could qualify a child under special ed. Again, the label does not drive program. So just because the child has, say, a learning disability in math, but maybe they need some social skills in some other area, they can add that in even though SLD would be their primary diagnosis. Now, you can have two diagnoses. I mean, you can have more, but typically it's the primary and then the secondary diagnosis that they can be listed as. So again, you're going to hear an acronym for almost every diagnosis that's out there, but SLD, or specific learning disability, typically within that report, then they'll break down where that disability lies. So is it with their math? Is it with reading comprehension? Is it with spelling? Anything of that such. Autism spectrum. And then emotionally disturbance, or ED, that's going to be more of your mental health behavioral kiddos.
Right. Isn't that such an unfortunate label that we still have? When I'm talking with parents, I try to turn it to like a maybe emotional disability. I mean, but emotional disturbance, I mean, that's a dated label. And I think there's conversation in Pennsylvania's special education code just to change that label, just as they changed the label of intellectual disability in the past too. So
Yes.
it's always a hard conversation. Like, we recognize that your child has anxiety. We need to make sure that we put the appropriate supports in place for your child. But in this report, we got to call it an emotional disturbance. Like, are you serious?
Yeah, it's that label is a little rough for parents. So we always try to explain a little better with the mental health side of things and how that looks. So a lot of times the school will just go with ED and not really try to say emotionally disturbed, because it is a rough label. So speech and language, we touched on that. Then there's visual impairment, including blindness, deafness, and then hearing impairment, which those two are classified different. Alex, do you have like the criteria for what classifies the difference on hand?
Not for those, not a qualified examiner for those. Yeah.
Okay. Yeah, I don't.
Not sure.
Um,
Yeah.
we do have several cases of them. It's not a common IEP disability that we come across, but they do qualify different. A hearing impairment might just be, as a child might need a hearing aid. With the deafness, it's typically all sound is gone. And then they have the category deaf blindness, which is a combination. Orthopedic impairment, so that's going to be looking at like your cerebral palsy diagnosis, anything that's more like that physical impairment. And then the ID, intellectually disabled. Traumatic brain injury, TBI, again, all these letters thrown out. You'll hear MDS, which is multiple disability, so that could be a child that has ID and cerebral palsy. I mean, it's a wide range.
It's a wide range. Typically, it's more the significant physical disabilities coupled with some type of hearing difficulties or intellectual disability as well. And then the final one, the other health impairment, is that umbrella term for other medical conditions that may not be covered here. The most common condition for students that fall under the umbrella of other health impairment that show a need for special education services is ADHD. So as you see here, ADHD isn't represented in the disability categories, but it would fall under that other health impairment category.
And that's a wide range of ones, so
Yeah.
a lot of disabilities fit under there.
Correct.
And then this is kind of just promoting advocacy, what to bring to an eval meeting. Bring the evaluation, make sure you read it ahead of time so that you are fully aware of what's in there, and then you can ask questions about anything that makes no sense to you. If it doesn't make sense to you, please ask about it. Don't just say, oh, I was too worried that I didn't understand it. I would rather have families ask and then really understand what the needs and strengths of your child are. Bring notes. Again, questions. bring a pen and paper so you can write down notes as you go, or just maybe hey, I don't know what these letters are, I'm going to write it down so I can ask about it then. Bring a friend, bring an advocate. We're here to help, so feel free to call us, questions, anything like that.
Yeah, this document should be the richest document that you've ever have on your child within the school. It's so much more than that of report cards or progress monitor things. I mean, oftentimes that's teacher narrative, academic performance on other report cards, parent information, rating scales, and then individual assessments conducted by the psychologist. I mean, it's not uncommon. I mean, my average typical report goes from anywhere between 22 to 30 pages single space to talk about the essence, the presentation of this child. And we're not doing it for nothing. We want to make sure that, one, we're diagnostically building a case and have information of why they may be eligible, right, why they may not be, but most importantly, what can we do regardless. So even if not eligible, it is best practice to say, like, what can we do now? We do recognize that these concerns were even brought up. What are some strategies that we can incorporate? And if they are eligible, this document is going to inform that very first IEP meeting or that very first individualized education program. So we want to make it as clear and specific as possible. So yeah, make sure that you're asking questions if things are not understandable, unsure, the numbers kind of just look haywire. You want to know more about them, or what does it actually mean? I'm hopeful that the psychologist and other providers that conducted the evaluation would be more than willing to reach out and have that conversation.
All right. So we did get a couple questions during. All right. Do goals have to be minimized through reevaluation if they are not consistently met? So I'm assuming over the IEP year, multiple years, if the goals are not being met. So if the goal is not being met in that year, it can be brought back, because if they're not achieving that goal, we need to look at why we're not achieving that goal. Is the goal set too high? Is the comprehension of whatever the goal is above their level? So we might need to bring it back to their level or change the goal altogether. But with that reevaluation period, so if they're on year 3 and they have to keep moving that goal back and it's not making any progress, when we reevaluate, that's an assessment that whatever that area is. So if it's reading, that's where we would really target that new assessment and really look at achievement at that point to see if maybe the reading comprehension, if now they qualify for a possible learning disability versus 3 years ago they didn't have a learning disability that they qualified for.
Right. That's a really good question. I think that and Lakin, thank you. I think you answered it real well. As far as when do we wait to change? I mean, schools, we have an obligation to now say that if there is no growth being made, we got to change something up. And we shouldn't be waiting 3 years for the reevaluation before we make the change. So that change should come from year to year, as Lakin indicated, whether it be, is the goal set too high? Do we need more intensive programming? Do we need a different type of programming? What are we using that's evidence-based? Are our teachers adequately trained in this? There's a lot of questions that can be brought up. We want to make sure we're addressing those on the spot. But despite those changes from year to year that they're making in hopes that we can start building students to grade level, and they're not happening, then the reevaluation with updated assessments may provide some rich information to help guide the next steps.
What if I have a particular assessment that I want the school psychologist to administer? Are they required to give what I ask for? So if the parent requests a certain assessment, can the school go ahead with that, or is that a requirement, or is that an optional?
If it's a specific type of assessment that's publisher based, no, the school isn't required to give that. What they are required to do is to make sure that they have a tool that measures whatever that assessment is intended to measure. So if they're looking into areas of written expression, they got to make sure they have a valid and reliable instrument and written expression. But no, it's up to the psychologist, and it's within their professional practice to choose what they feel is most appropriate for that. They just have to make sure that they're able to measure the broad skills necessary to make educational determinations. Yeah.
All right. Sorry, I have to scroll up. How does the school psychologist help the school staff understand how the psychological should impact instruction?
Right, good, very good question. So the psychological testing, so outside of the academic, I think that's kind of straightforward how that could maybe impact instruction. You know, they're below average reading skills, math skills. We got to make sure that we're providing instructional level. But what about the intellectual piece of it all? And if I'm answering this right, when I think of psychological cognitive, I'm thinking of that type of testing. But if you're thinking of mental health too, that's also a different conversation. But I'm going to start with the intellectual assessment first. So if there are difficulties, let's say with a student's work or with their memory, okay, we notice that there's problems acquiring information. As a school psychologist, I want to find out, is this only when they're remembering information that is heard? Is it also the difficulties also seen when they're trying to remember information that is seen? If there's a strength in one area or the other, that's going to help inform me. I'm going to talk to teachers about this. Hey, this student does best when they're learning things that are visually presented. So when you're giving them directions that are multiple, there's a multiple points to it, use checklists. That's going to help them be more successful. Try to use multiple ways of getting that information across. Get as much visual things across as you can. And if they're in special education, their learning support teachers or their case managers that are special education teachers work hand in hand with all their teachers to make sure that these materials are available. If it's intellectual difficulties with things like processing speed, it's like this student may take a longer time to get their words out or to get their writing out. So let's make sure that we provide them that adequate time. It's not because they're being defiant, it's because that they need that additional processing times to think and collect their thoughts. What you can do to help with you knowing that they understand it, make sure that they have organizational things put in place, graphic organizers to kind of detail their thoughts, and use that as a way to kind of, you know, gain sense of what they know, what they don't know, where they're going with their response. But that could be another example how I use that intellectual performance to give recommendation to teachers. Sometimes students, they don't do as well on things that require verbal memory, or sorry, reasoning with the verbal information. And if that is a need that I see, so so we assess that by doing things like riddles, comparing vocabulary, how things are alike, how things are different, giving vocabulary terms. And if students are having difficulties just recognizing and using language, we can talk with teachers and say, this student may need to build up their background knowledge more so than most students before they learn anything new. It's really limited right now. It may not even be there. So what can we do before they even get to this first instruction to preview things to help them be more available, more successful when it's taught to everybody at once? So that's why we call them individualized education programs afterwards, because it's very individualistic type of needs that need to occur per student. But these types of evaluations help us bring about what those individual needs are. If it's psychological based, mental health based, we make sure that there's emotional support people in place for that, avenues of support for counseling, social skills, things such as cognitive behavioral therapists and ourselves. Oftentimes we work one-on-one with students to try to challenge some school-based worries or fear to help overcome that. When working with teachers, so one of the more common ones is students just have a fear of going up in front of the class and present. And sometimes teachers are real sticklers in making sure that's graded. Well, knowing that psychological need for that student, I'll tell that teacher and working with their team that can't we just assess their knowledge in another way right now instead of just doing what we know they're going to have a hard time doing? They're not ready to do that yet. So perhaps the student is okay with being recorded and they can do it that way. Maybe they're not. Maybe they can just talk to you and present in the hallway and in another area that's more one-on-one based if you want to see their articulation types of the abilities to communicate their skills. So there's a variety of things that you can do that looks different than general practice based upon student needs.
All right, so we did get one more question. Why doesn't school accept a child's preschool enrollment with support such as social skills and speech in order to continue services at transition as a matter of course?
Ooh, I think, so let me, can you repeat that one more time? Like, and I'm trying to conceptualize this. So it's a preschool transition,
Yeah.
and I'm curious as to why they didn't continue the supports.
Yeah, that's what I'm kind of, so typically what occurs is if a child is found eligible through the intermediate unit typically, and they have supports that are either push-in or they're at an IU classroom for preschool, as long as they have that IEP, when they're going into kindergarten, that IEP follows them. Now, if a child, a lot of times the label is developmentally delayed, and that is not a category for an IEP. So they'll have to reevaluate, and it might just be that review of records, and then they would pick a category that would better fit that child's needs, but in a kindergarten level. So if they have speech, they would just move into the SLP, and that would continue into kindergarten. Now, a lot of times once the child's in kindergarten and the school gets to know them and the staff is more aware of how that child's handling that environment, they'll reevaluate, and they might add new assessments than what preschool had. So, and I don't know if you want to add more to this question, if you're aware that did they end services? Did they drop the child prior to kindergarten?
That's what I'm curious, were they no longer receiving special education services by the time they were school aged at all? Did they completely drop it?
Right. So if they went through like an early intervention and they graduated through that and they did not need any more services through the IU, then that whole process would happen again once the child's in kindergarten, if they would need those supports. But typically, if the child is eligible going into kindergarten, that IEP would follow right into kindergarten.
Typically, there's not a disruption, not unless that the school says like, well, we're going to reevaluate going into the school year and just to see the degree of needs, and maybe there's no longer a need at that point, but that information should be perfectly clear as to why there's no longer a need. Perhaps maybe there's a maturation process with their speech and language needs that they are now on target or consistent with other peers their age, and there's not a need for service at that point. But if there wasn't such an evaluation and speech and language was the initial disability category, that's a school age disability. So I don't know, I'm kind of puzzled about the discontinuance or the disruption in services too. I probably need to know a little bit more about it.
And that's where you would call me, and then I'd get involved.
Yeah, you're in good hands with Lakin. Yes.
All right, and one last final question. Should the child be at the meeting for the reevaluation? Should they know their strengths and weaknesses?
Yeah, that's a really good question. And I think that it all depends upon the knowledge of that child themselves. Now, typically, the older they get, the more involved and a part of the team that we want that child to be. However, there are some conversations that take place during the meetings that, especially when we're talking about skill deficits and things like that, I think the parent and guardian knows that child's best. Are they okay about hearing them and the nature of them? Or would it be okay to invite that child in at another part during the meeting where they can talk about their own perspectives and what they need too? So they may not need to be involved with the entire meeting itself, but a portion of it. I would make sure that the student's comfortable with it. And if they have been in special education for a while, their case managers or their special education teachers that they work very closely with, it is best practice that they do participate eventually. And if they are nervous, they certainly should be encouraged to attend, or at least present their perspectives to some degree, whether that be in writing for us to read as an IEP team if they don't want to be there instead of the table, because that is intimidating, I would imagine. Or like I mentioned before, not be there for the whole time, but maybe for the last 5 to 10 minutes of the IEP.
Alrighty, that was all our questions. So I'm gonna unmute Lisette here. Maybe. There you go.
All right. Thank you guys so much for attending. Thank you, Alex and Lakin, for your extensive wisdom. So the winner that we have drawn is Patricia. So if you could just email me, or I can reach out to you with the information that we need to mail you out your box of cookies.
We test tried them. They're very good. Alrighty. If anyone has any questions following this, feel free to reach out. You guys have Lisette's email. She can always forward me questions, or you guys can always call into the office and just ask for me. I'm more than welcome to give you guys some advice or help you through any issues that might come up this school year. So, and then just to recap, next month on November 12th at 6, we are having the ABCs of the IEP. And again, that just breaks down each section of the IEP and puts it a little bit simpler for parents, because school staff, since they're so used to that realm all the time, sometimes it just becomes very confusing. So we're hoping to simplify that a little bit and that you guys feel more confident of knowing the parts of the IEP. So, all right. And thank you, Alex, for presenting tonight.
Yeah, you bet. Thanks for having me. Thanks for joining us, everybody. And if you email Lisette, and Lisette kind of like bounces ideas off of Lakin too, Lakin, feel free to reach out to me if I can help in any way. You just let me know. I can be here on a consultative basis too. Okay?
Sounds good. Thank
Okay.
you. Have a good night, everyone.